Hello and welcome to Doc Talk Live. This is NorthBay Health's way to reach out to the community on important health information. Today we're talking about monkeypox, and we have with us NorthBay's infectious disease specialist, Gregory Warner, DO, a master's in public health, and we're going to answer your questions after some brief comments here. So if you have a question, type it in. We'll be able to see that and pass it along to Dr. Warner. So take it away, Dr. Warner.
Thank you for having me. So today we'll be covering monkeypox. We'll talk about a little bit of the history of how it's been significant in the past, the challenges we're facing today, and talk a little bit about what to look for with symptoms, treatment, prevention. So historically, monkeypox has been a pretty rare disease. It is related to the smallpox virus in the same family. It's a concern for public health officials, mainly because, much like smallpox, the disease can be transmitted by individuals who are sick, animals that are sick, or materials that can be contaminated. And so, luckily, monkeypox is less of a severe illness when compared to smallpox, and it is less transmissible. So historically, monkeypox has just been occasionally noted in Central and Western Africa. When I say occasionally noted, in the US, it was only really seen in returning travelers who were sick, individuals who have been exposed to infected animals. So it was fairly sporadic. Fast forward to where we are today. Across the US, we have just under 13,000 cases. In the state of California, just under 2,000 cases. And in Solano County, 21 cases reported. So the other important fact to note also is there have been no deaths in the United States up until this point. So symptoms. Everyone is very interested in knowing what are the symptoms of monkeypox. So more commonly, we see generalized flu-like illness. So symptoms much as feeling run down, feeling very fatigued, muscle aches. You can have fever as well. We'll see lymph node swelling as well with monkeypox. Then a few days later, you'll notice the onset of an unusual looking rash. The rash is usually characterized by blisters that are fluid filled that increase in size. Over time, they'll crust over, and those lesions will eventually fall off. This whole process can take upwards of 2 to 4 weeks. As far as transmission is concerned, so we think of transmission in 3 specific categories. First and foremost, the most common being skin-to-skin contact. These are settings of more intimate or sexual in nature. And so that is what we're seeing as far as the majority of cases that are being reported as of now. The second possible transmission route is through respiratory droplets. And so sneezing, coughing, generating larger droplets from the saliva. And those can certainly lead to transmission, but you have to have close face-to-face exposure for a longer period of time. And so that would be a potential other cause. The last theoretical mode of transmission is from contact with contaminated items, doorknobs, materials like a tabletop. In theory, the virus can remain viable on a surface for weeks, and theoretically can cause disease. Again, we're not seeing a large number of individuals presenting in that context who have not had any other exposure to anyone with known history of monkeypox. So I don't think that is a significant mode of transmission. So if there are any questions at this point that we could move into.
Well, we have a question from Janice, and Janice, thank you for typing it in. And just a reminder, anyone who's watching, you can type in your questions. We'll see them and pass it forward. Janice is asking, since it's related to smallpox, right? If you have had a smallpox vaccine as a child, are you protected from monkeypox?
Janice, thank you for your question. So the smallpox vaccinations have been administered up until 1972. We know that the protectiveness is maximized for the first 3 to 5 years after vaccination, and that effectiveness will wane over time. And so the best I can answer at this point is there is some degree of protection, more than not ever having gotten the vaccine, which is for most other individuals. And so you can say that at this point, you can rest assured that you have some degree of protection. How much? Unfortunately, as we're in the early phase of this, we'll find out more and we'll be able to communicate that more, but rest assured that you have some degree.
So you explained that monkeypox is caused by a virus. And one thing we've seen with COVID is that viruses mutate and you get different forms of it. Is that the same with monkeypox? Are there different forms of the virus?
So in general, it's one disease process. There are two main strains, or as virologists call them, clades of virus. One causing more of a severe illness, one causing more of a mild illness. In the US, up until this point, they have identified both strains circulating. But luckily, most illness that has been identified has been fairly mild and self-limited. Not to say it's not pleasant, but again, it's not led to severe outcomes. And so, yes, two main strains, but again, from the standpoint of the infectiousness and the disease process, it doesn't make a huge difference. It hasn't made a huge difference so far in the U.S.
Okay, and Yvonne is watching and she's asking what products are best for cleaning surfaces if you want to keep from getting the virus.
Yvonne, that's a great question. So the good news is everything that we have available to us, as simple as alcohol hand gels, as simple as bleach wipes, or any other antiseptic wipe that you buy from the supermarket, will be effective enough to sterilize and kill the virus on any object. And so it should be quite easy to clean and sanitize surfaces.
Okay. When should someone get tested, and how do they do that without potentially exposing others?
So first and foremost, if you suspect that you've been exposed to someone who has monkeypox, or you suspect based on your symptoms with fevers, with an unusual rash, first and foremost, you need to isolate at home. You need to sequester yourself at home so it minimizes the potential to transmission to others. Number one. Number two, please call your doctor's office and let them know your concern. Clinics, hospital systems, emergency departments, if they're notified ahead of time, there are methods and protocols that can be set in place to try and minimize transmission to other individuals, say in the waiting room, for example, if you are sitting close to them. And so first and foremost, notify your physician's office. If you don't have a primary care doctor, I would recommend contacting your local public health, county public health jurisdiction. Solano County Public Health has a number of clinic phone numbers listed on their monkeypox information page as a reference.
And is that the same for with or without symptoms? Like if you think you've been exposed but you don't have symptoms, or if you actually have symptoms?
Correct.
Yeah,
I
it's the
think
same.
both situations, you want to make sure if you have a concern, sequester yourself and call a healthcare provider.
Okay. What are the common symptoms, and how long does it usually take to get better?
So common symptoms, again, earlier on, it's flu-like syndrome. We see just feeling very run down, fever, lymph node swelling, muscle aches. Within several days later on, these fluid-filled lesions can erupt. They can erupt anywhere in the body. They can erupt on the chest, the arms, the legs. They can manifest around the genitalia, the rectal area, around the mouth. They can be very sensitive and tender areas as well. So it can manifest anywhere essentially in the body. And then on top of that, those lesions can take upwards of 2 to 4 weeks to resolve. So you're looking at potentially a month-long illness from the onset of the flu-like symptoms to when the actual lesions on the skin, the rash, completely resolves.
And so, I'm sorry, maybe I missed it. How soon after contracting monkeypox do the blisters start to appear?
It could be a matter of several days to a week.
Okay. So how long are you contagious, and how soon are you contagious with this?
You are contagious from the very first onset of symptoms. So the day you present with your lymph nodes swelling, you feeling run down, having fever, that's when you could potentially be transmitting it by the droplets. So if you are close to someone, physically close to someone, whether it's by kissing or close physical contact for a prolonged period of time, that can lead to transmission. And you are transmissible. In other words, you are shedding virus for the entire duration especially until those crusts, those fluid-filled blisters on your skin crust over and they fall off. Once they fall off and new skin forms, that's when you're no longer infectious. So it could be theoretically up to a month of infectivity.
Okay. Patty's asking, and I know we've gotten this question from a lot of people calling in, how can we help keep our children safe now that they're back in school?
That's a great question. I had both of my kids back in school today, so it's on a lot of parents' minds. What's comforting to note, as of now, there have been 8 reported pediatric cases of monkeypox. From the type of transmission we're seeing, it has not been rampant amongst the pediatric population. Does that mean we need to not be concerned? Of course, we should be concerned. So what we know as far as transmission from close skin-to-skin contact, so daycare settings, schools, is that possible? Certainly is. Close face-to-face transmission from droplets, is it possible? I guess theoretically it certainly is. So what do we tell our kids? Hand hygiene, I think, is something that we have to reiterate again and again. Good old-fashioned soap and water, using the alcohol gel for our hands, and reinforcing good practices with our children. Avoiding putting your hands in your mouth, which is, of course, hard to do with small ones. But as kids do grow up, reinforcing that practice as well. And I think as parents, there is that personal responsibility that we have to reinforce and remind again and again. If your child is sick, has fever, looks like they're developing flu-like symptoms, or even has an unusual rash, please, please, please keep them home. Do not send them to school or their daycare setting. As challenging as that may be, that will have a major impact on our ability to minimize this involvement of this infection with children.
Now, Andrew's asking about smallpox and is it contagious? But I'm also curious, do we even still have smallpox?
Smallpox is very contagious, and in fact, more contagious than monkeypox. We don't have smallpox, thank goodness, anymore. It was eradicated due to public health efforts with vaccination. In fact, it only exists in 2 laboratories in the world, one in the US and one in Russia. So it is not actively circulating, so we do not have to worry about smallpox per se. But this family of viruses, monkeypox, smallpox, they are very much infectious by the means I've discussed earlier with skin contact and droplets.
Should people be concerned about going to, say, crowded events?
Yeah. Before I begin with that, from the data we have of those who have been diagnosed, we're not seeing large number of reports of people getting sick after going to venues for concerts, for large gatherings. Even though you have a large number of human beings in the same place, there still is enough physical distance where the transmissibility is just not that good. And so again, most cases are linked to close, intimate contact, whether it's a caretaker taking care of someone that has monkeypox, where they have to take care of a loved one and they have to be near that individual. Transmissions have been reported. And then, of course, the intimate and sexual contact that we're seeing in the vast majority of cases being the most common mode of transmission. So crowded venues right now at this point are not a major risk factor.
Okay. Is there a treatment for monkeypox, like something you can do to make it go away quicker?
There is, thank goodness. And so we have 2 specific interventions. One is vaccination, and the other is an antiviral. So we'll first talk about the vaccination. So there are 2 vaccines that are available for prevention and post-exposure prophylaxis for monkeypox. For the purposes of our discussion here, I'm going to focus on one. The Jynneos vaccine, which has received an emergency use authorization by the FDA, is a vaccine that was originally designed and studied for prevention of smallpox. Of course, hasn't been used because smallpox has not been an issue for some time. But it is currently being offered for prevention and what we call post-exposure prophylaxis. So to start with pre-exposure prophylaxis, getting it before you get sick. Who should get the vaccine? Right now, we are focusing our efforts on individuals who practice what we call high-risk behavior. So individuals who engage in sexual behavior or intimate non-sexual behavior with larger groups of individuals where there's lots of close skin-to-skin contact, close potential droplet transmission from prolonged face-to-face exposure. In addition to that, commercial sex workers also have been offered or should be offered the vaccine for that same reason. As far as post-exposure prophylaxis, that means getting the vaccine after you've been exposed. So we are emphasizing the vaccine be offered to individuals who have been exposed to try and either prevent the infection from happening or from reducing the severity of the infection. If the vaccine is offered within the first 4 days of exposure, it can theoretically prevent the infection altogether. If the vaccine is offered from about 4 days to 2 weeks after exposure, it will reduce the severity of the infection and the duration of the infection. It's important to emphasize that the vaccine is derived from the vaccinia virus. It's a virus that, when introduced into human beings, cannot replicate. So it's actually a live virus that they're injecting. But it doesn't replicate, but it has proteins on the surface of the virus that mimics the monkeypox infection and the smallpox infection. And so what it does is it elicits an immune response. It has been tested in animal trials has not been deemed unsafe in pregnant females as well. It is indicated for young children if need be as well.
Okay.
And then, of course, the antiviral. So the antiviral is the generic is called tecovirimat, or TPOXX is the brand name, which it's much more commonly known as. The antiviral is available now in limited supply, much like the vaccine at this point. As we are moving through this public health crisis, we are working with government, state, local officials as best we can to ensure proper supply. But at this point, we are still working within the confines of limited supply for both. With the antiviral itself, it is indicated for severe illness. So as much as I've emphasized the situation where monkeypox leads to relatively self-limited disease, there are certain circumstances that it can become more severe. So in individuals who are immunocompromised, meaning they have a weakened immune system, whether it's because they're a cancer patient getting chemotherapy, taking medications because of an autoimmune disease that suppresses your immune system, HIV/AIDS patients, organ transplant recipients, individuals that have these problems. And in addition, pregnant women and kids under 8 are listed under that susceptibility, hyper-susceptibility category. They can actually develop pretty severe illness being pneumonia. They can also get meningitis, where the tissue that surrounds the brain and spinal cord can get infected, and if not recognized early enough, if not treated early enough, can lead to death. So the good news is we haven't seen that yet, but it can happen. And so if any of these individuals in the higher risk category we just talked about have had exposure and have had confirmed illness, they would qualify for treatment with TPOXX.
Okay. But the availability is really the issue right now on these things. So.
Right, because it, much like the vaccine, has received emergency use authorization, which means a lot of county jurisdictions and larger hospital systems, there's a lot of paperwork that's involved with becoming enrolled in the trial for utilizing these medications. It requires timing from the time that you get the process rolling and get the medication into the patient. It could be quite a while. That's why the availability of the vaccine is also very important as well.
So how do you find out if you're eligible? I mean, who do you call? Where do you go?
So first and foremost, we want to defer or refer to our state and local public health jurisdictions. Solano County specifically has a number of health clinics available to call and ask these questions. On their website, solanocounty.com/monkeypox, there is information available as far as who would qualify. As I mentioned before, if you engage in certain high-risk behaviors, as I mentioned earlier, you would be deemed appropriate for the vaccination. This information, of course, can be found on northbay.org/monkeypox as well. And so I would highly recommend that you check out those websites. You can call the phone numbers and ask. And of course, feel free to contact your own physician and a healthcare provider to clarify further.
So just in general, how worried should the average person in Solano County be about monkeypox?
Yeah, we should be aware. We should be aware that there is a public health crisis. Now, does it affect every single person? Does it affect all of us? Not necessarily. There are very specific types of behaviors or risk factors that we've talked about that put you at an elevated risk. And the vast majority of cases we're seeing are from individuals that are physically close to another human being that can get sick. We're not seeing large numbers of individuals getting sick from walking into a supermarket. We're not seeing children getting sick from going to school or daycare. We're not seeing individuals coming from concerts in droves coming down with monkeypox. This is not the case. All we have to do is stay vigilant, make sure we keep our basic practices of hand hygiene employed with ourselves, with our children and family members, and making sure to avoid others if they're sick. If you have a child that's sick, for example, please keep them home. As far as trying to maintain the health of our community, I think that's a very essential part of it. So be aware, be vigilant, but at this point, it is not a reason to be overly concerned about everyone's well-being, as the risk factors for this are very specific.
Now, we talked about vaccines, but there's a lot of vaccines going around these days from COVID. We're coming up on the flu season. They're going to get flu. This vaccine, how much time between vaccine shots, or can our bodies handle that many vaccine shots?
Yeah, that's a great question. So, there's been recent recommendations put forth specifically with the COVID vaccinations. They're recommending a spacing by about a month. And it may be a situation where both vaccines elicit a fairly robust immune response. And so, we wouldn't want you to feel pretty run down and ill by getting two different vaccinations very close to each other. To minimize that spacing out is just, it would make sense. So by 4 weeks with the COVID vaccine and the monkeypox vaccine, the Jynneos vaccine, if you are deemed appropriate. As far as the influenza vaccine, there I've not seen formal guidance, but I would specifically recommend at this point that you would space it out. The longer the better. So by several weeks would make sense, just to make sure that you don't feel too poorly after getting a vaccination for influenza, and then on top of that, if you need to be vaccinated for monkeypox as well.
Okay. All right. Well, it looks like we have come to the end of our time and our questions. So thank you, Dr. Warner, for taking time out of your busy schedule to answer these questions. Our next Doc Talk Live is being rescheduled. It was going to be tomorrow on knee replacements with orthopedic specialist Andrew Brooks, but we've had some scheduling issues, so stay tuned to NorthBay's Facebook page, and we'll give you the new dates and time for that. Thank you for tuning in, and thank you, Dr. Warner.
Thanks for having me.